Hello and good afternoon to all the participants. Thanks for joining us. While we were waiting to get the session started, we had concluded a couple of questions on the poll. I will also share the reports, the results of the poll in a bit. This is Mai from Prudent Insurance Brokers. We thank you for taking interest in the health and wellness and improving the quality of your life and of those you love. Today, our topic is a very relevant one as we all are facing high pollutants in the air. According to the World Health Organization, air pollution is the world's largest single environmental health risk, with a wide range of negative health outcomes, including both morbidity and mortality, and associated with tremendous external costs for society. So we hope to learn and take away some useful advice from our eminent speaker today. Now, a quick word about our speaker, Dr. Satyanarayana Mysore. He is the head of department and consultant of pulmonology and lung transplant department at Manipal hospitals. He has a very rich experience and expertise in the field of respiratory medicine, sleep medicine, interventional pulmonology, etc. He has also received many awards like the Best Clinical Teacher Award, Professor Derek Frewin Citation Award from the University of Adelaide, and the Cochrane Research Scholarship Award. A very warm welcome to you, Doctor.
Thank you, madam. Thank you for the kind words.
Great. Doctor, before we start the presentation, I was just doing a poll. I'll share the report. We had a quick poll, 3 questions only. So our participants answered this. Do you have any existing lung problem? Was the first question that we asked our participants. 2% has existing lung problem, and 98% said no, which I think is a great result. Then we have yes, absolutely. The next one is, do you get exposed to air pollution on a daily basis? So I think this is very relevant to what we are going to talk today. Yes by 64% and no by 36%. Right. And the last one, we just checked on the awareness of our participants. What protective measures do you take against air pollution? Wearing masks, of course, I think it's a mandate now. So 79% are wearing masks. Daily air pollution forecast, 2% are reading them. Avoid exercising outdoors, 12%. Air purifiers are utilized by 7% of our participants population today. So that's all from my side. Over to you, Doctor.
Thank you for the kind words. Ladies and gentlemen, it's a pleasure, privilege to spend the afternoon few minutes with you all on this important topic. So I was viewing a lecture on air pollution by Matthew Johnson, and he starts off by saying in his TED Talk interview that after the massive, the World War I, World War II, then the credit should go to air pollution, and air pollution will work hand in glove with the prevailing twindemic or pandemic of COVID. So air pollution is a big issue. Now, to say that is easy, but what is air pollution? We want a certain density, certain specific concentration of substances, air to be rich in oxygen up to 21% at ground level. We may not even want oxygen to decrease to 16% at the peak of the Himalayas, and that would be the best possible air to have. However, when we say air pollution, that means there are presence of harmful substances or undesirable substances in the atmospheric air at an unacceptable concentration, which can either be man-made or through the natural phenomena. Volcanoes can time and again contribute to natural thing. Flood can contribute. Burning of fossil fuel, vehicular pollution, emission, all this is man-made. So there are number of pollutants, and this could include liquid, molecules, gases, and other things. However, the basic physiology is at a very high temperature, in conjunction with the sunlight, industrial heat, some of these gaseous things do condense, and particulates are vis-a-vis, attain a gaseous nature. Ammonia, carbon monoxide, sulfur, nitrous, methane, chlorofluorocarbons, and various other biological molecules. Now, I did plan and decide that when I speak about air pollution, I will specifically refer to indoor air pollution. Indoor air pollution gets a stepmotherly attention most often. People will always talk about atmospheric air pollution. So the 64% who were exposed to atmospheric air pollution and the rest who said they did not, invariably we all get exposed to indoor air pollution. Solid fuel may not be, firewood may not be, crop waste may not be, and 83% of, so there is a rural urban divide. But in an urban setting, can indoor air pollution happen? And that brings us to the radon pollution. Radon is a colorless, tasteless, odorless gas that is produced by decay of radium, and it may not surprise you if I say that the building material does have an expiry date on it, theoretically, and most of the older buildings, in a survey done on Cuff Parade and other well established housing societies in the central Mumbai, the emission of radon was higher in buildings that were older. That is where the industry of rebuilding or renovation came into. With renovation, you are pulling down the particles that have already decayed and radon pollution, and that will further pollute the atmosphere. So the point that we should remember from this slide is, I may say I live in a very clean environment. I drive in a car and I am not exposed to atmosphere that much. I have a air cleaner, air cooler, air filter, all these things. But the point is, the place I live also does slowly contribute to pollution. So radon in particular has been investigated because it makes a bulk of contribution to lung cancer. So what it does is, it does lead to radioactive polonium, lead, bismuth, and these are solid materials, and they attach to the lung membrane when they enter the lung, and within the lung they continue to release alpha and beta particles that cause cellular damage. Now the same we have seen in the last 20 years, a flood of building material, building that huge number of deforestation and buildings coming up. So the natural forest areas are being deforested. Housing is almost a fundamental need for everyone, and with that, building materials, hardwood, plywood, paneling, fiberwood, they all use adhesives that contain formaldehyde, and that does contribute to some degree of indoor air pollution. All historic buildings before 1970s do contain asbestos, and that is very clearly linked with lung cancer and mesothelioma. So let us move over to the favorite topic that everyone relates to from this less known indoor air pollution. We move on to the outdoor air pollution, and here comes particulate matter size. So there is PM10, PM5, PM2.5. So what does it mean? How is it relevant? What does this particulate matter signify? I will come to that. There is ozone, nitrogen dioxide, carbon dioxide, sulfur dioxide, and these are essentially due to combustion from motor vehicles, solid fuel burning, and industrial pollutants. The other contaminant comes from crop burning, dust, and biogenic emissions. So, coming back to what we earmarked for discussion, PM only indicates, PM10 indicates that is 10 micrometers, PM 2.5 micron, and 2.5 micron. What is the relevance here? The relevance is the smaller the particle, it is easier for the particle to diffuse and get into the lung. We need to remember that the average human nose is meant for humidifying the air, adds water content, heats up the air to desired level with that of the body temperature. And that is why if you jog or run and do mouth breathing voluntarily, the mouth becomes dry. So the nose will only filter particles right up to 2.5, and beyond that, any particle that is smaller than 2.5 will have fair chance of getting into the turbulent air that is making inroads into the lungs. And such fine particles do come from combustion, and these particles cannot be easily overwhelmed by the respiratory system. There are immediate effects and delayed effects. The particles do upset the lung innate immunity, the immunity that we are all born with, leading to local allergy phenomena, burning of the eyes, burning of the nose, throat, lung irritation, coughing, sneezing, shortness of breath. So there are a number of studies that have shown increased exposure to particulate matter 2.5 and less, and hospital admissions do linearly go up. Then we do see what is AQI, air quality, and we often read, don't visit this country because the AQI in the last 3 weeks has deteriorated. AQI is kind of what we call as a thermometer that runs from 0 to 500 degrees. That is one way of understanding, but it takes number of parameters over a period of time, 2 to 3 weeks usually, and say, okay, this has been the air quality standard in the last 2-3 weeks. So can we plan a trip or tour into that particular region? The other way of looking is we get weather forecast, and if the AQI is between 50 to 0 to 50, then you are reassured of no harm to the individual. All outdoor activities are welcome. If the AQI is between 301 to 500, that is hazardous. Going out is going to be limited, even for the purpose of exercise and outdoor activities. Based on the average AQI, India does appear in the top 5 polluted countries in the world. There is no doubt that technological revolution has contributed to this, and equally so technological innovation, regulation, NGOs, voluntary acts of certain individuals have all contributed also to keep it in check, because the reports are that our AQI would have been much worse if progress had not been achieved on this front in the last 10 years. Vehicular pollution is pretty small compared to industrial pollution and rural areas where bioorganic waste is generated. Now, the other issue is crop burning. Crop burning, the government is seriously looking at alternatives to this. And when you look at a problem statement, you have 35 million tons of crop waste from their paddy field. To dispose this in a safe and efficient manner, with due respect to the environment, would cost a huge amount of money for the farmers. Therefore, this becomes a issue that the state will have to involve along with the regulatory authorities and NGOs and volunteer organizations. So when we look at our distribution of AQI and what happened during the January to April, I would say the lockdown 1, 2, and 3, there was a significant drop in the air quality. Despite that, it was not in a very acceptable manner. The Himalayan ranges not visible was seen. The native cat of Bengal started returning back to the Bengal areas during the lockdown, and number of ecological reverses took place. So lockdown was an eye opener for all of us to say, how much do we pollute? That's the problem statement. And there are no easier answers with the unlock 1, 2, and 3. We are back to facing pollution. Diwali has become, a poster kit for quite a controversial contribution to yes or no to the atmospheric pollution, outdoor pollution. Green crackers were bought in with 3 varieties: water release crackers, low intensity, less sound, less aluminium, and SAFAL varieties, which was a CSIR initiative. And this Diwali marked, and this is a very important aspect, because the number of post-COVID lung individuals in our country at this point of time is huge. There are many on oxygen, and any effort to bring down outdoor pollution is paramount, is of paramount importance. So when we look at sulfur dioxide to nitrous oxide to PM 2.5, and you compare before Diwali to post Diwali, yes, there is a marked rise, but there are also issues. Note that between the north and south of India, north crop burning happens, and you can't distinguish whether this contribution is solely due to crop burning or Diwali. Now moving away, we delve into health hazards of air pollution, whether indoor or outdoor. It is no rocket science that poor air quality has a drastic effect on human respiratory system. And what do we see commonly? We see reduced lung capacity, stiffness in the lung, therefore lung capacity comes down, sore throats repeated, cough, fatigue, lung cancer in the long run, and in the immediate thing is a headache and more incidence of migraines. Household and outdoor particulate matter pollution also leads to infant mortality rates to rise. Heart is not spared, so is neurovascular system and the lung most commonly. And we do, when we look at the deaths, overwhelming, much more overwhelming than the COVID is the air pollution leading to mortality. Yes, in the current pandemic that we are all unfortunately in and battling through, air pollution becomes important. But it becomes important. Can it become important directly? It can if the air transmission rather than droplet transmission is proven. I'm sure you are all sensitized to the fact that 200, 300 odd scientists wrote to the WHO saying, please entertain the possibility of air transmission of COVID. And if in reality air transmission does occur, the smog and the slow movement of passage of air and the ambient air which tends to remain longer, all these three put together due to air pollution will keep the virus in suspended animation, and the virus is less than 2.5, very much so, and that will increase the incidence of COVID. For the post-COVID patients, it will contribute definitely to the mortality because their lungs need much more protection. When we look at the major killers of lifestyle, encroachment, that is hypertension, diabetes, coronary artery disease, asthma, COPD, all these are negatively influenced by air pollution, and their mortality will go up in both COVID, and air pollution will contribute to that. It is believed that the air pollution does in certain models, animal models, has been conclusively shown to induce inflammation, and that creates less resiliency and greater vulnerability. So rather than only talking on a nihilistic or a pessimistic note, let us examine carefully and see how can we all contribute to prevent air pollution at a micro level, at a macro level. The first thing, we always turn our heads to the government. So government has many responsibilities, pioneer green initiatives at all levels of the society, formulate novel regulations to combat air pollution, carrot and stick policy, so incentives for compliance with the regulations, and form an active collaboration with the industrial sector to innovate. The industry, on the other hand, should be prepared, geared up to innovate, reduce dependence on fossil fuel, environmental friendly regulation, enforcing the regulation in their chain, and bring in and brace innovations wherever possible. And as a CSR initiative, build energy friendly materials for the buildings, and afforestation. Individuals, composting instead of crop burning, refuse, reuse, recycle, and that is happening in India with respect to bags, plastic bags. And afforestation in the urban milieu, what an individual can do is tree planting. Also, any festivity, try to use an eco-friendly venture or alternative, and incense sticks to candles to mosquito, all of them do contribute to indoor air pollution. The NGOs also do have a lot of responsibility when it is legibly and legally involved with a clear purpose. They need to work as a bridge between the government, industry, and individuals. And that will be the work of NGOs. So I'm sure that basis this talk, there is some incentive for all of us to get into efforts for reducing pollution, contribute less, and afforestation at micro and macro levels. Thank you for your patient listening, and I'm happy to take any questions on this front. Camera view.
All right. Thank you, Doctor. Now, I request all the participants to put in your questions in the question panel, and we shall read them out for the speaker. There was, as a first question, Doctor, there was a recent publication, or rather research, done on the correlation of COVID-19 and patients with an air pollution and patients with lung disorders. Can you throw some light on this topic, and what's your thought on that?
Just pardon me, between what? Air pollution and?
COVID infection.
Yes. So in simple words, COVID is a droplet. We are looking at impact on COVID transmission. We are looking at impact on the COVID severity. And third one, mostly post-COVID lung. How do you nurture it, and how does pollution adversely impact? Coming to transmission. For transmission to happen, if indeed WHO endorses the scientific community, at least one major section of the scientific community, which says that there is air transmission in COVID, then the smog, the air pollutant, the passage of air, the stagnation of air, I would say, both indoor and outdoor, will keep the SARS-CoV-2 virus in suspended animation for more lengthier length of time, and that will enhance the transmission part. For those patients who are looking at home isolation, and if it is indeed a very old home and we have looked at the indoor pollution, there is going to be some impact. When you look at post-COVID kind of scenarios, you have been discharged, but you have to go on oxygen. You're not yet cough free or breathlessness free. Pollution will slow down the way you want to, the faster you want to recover. That will be proportional to pollution, or inversely proportional to pollution.
Right. Great. The next question is, what do you think about using air purifiers? Is it helpful, or is it a waste of money?
Yes and no. I'm sorry, I'm answering in this way. Yes and no is, I always thought it was an yes. Johns Hopkins did a study, and I met the pulmonologist, the lady pulmonologist who spearheaded the study. They found that while it is quite good in reducing the ambient air in a particular indoor capacity, room or hall or whatever, the amount of emission and the power consumption by a air purifier negates the beneficial effect. So you need to have something that is much more energy efficient when you look at the current air purifiers available. Having said that, when would we advise somebody to use a air purifier is if somebody has disabling symptoms of allergic rhinitis, which means it's a cousin of asthma. the upper airway tends to react to pollens, dust, house mite, itch mite, um, cloth, termites. So these patients, early morning, as soon as they wake up, they tend to sneeze many times, watering in the nose, watering in the eye, and it tends to improve as the day gets along. By 10:30, they are in much better shape compared to what they were at between 6 and 8. And the pollen count is also high during that time. So in such selected individuals, one could consider using indoor air purifier, provided they calculate the surface area and the capacity of the air purifier.
All right, doctor. Gym and fitness centers are closed environments. When we do work out, carbon consumption is more, and does that impact our health? Is there any chance of COVID infection when working out in a closed environment?
The first question is a bit difficult to answer. Second one, very easy to answer. So basically, when we look at COVID transmission in a gym kind of center with a AC on and things like that, there is no doubt that this contributes. And I have personally had patients admitted under me who managed to stay out of the gym for the most part of the lockdown and unlock, but towards August end went the government regulation in Karnataka, at least August, end of August, September, gyms were given permission to open up, and there were regulations that you can only allow few people at a time into the gym, and there was increase in incidents gym related. So that we have seen.
All right. Does steam inhalation on a regular basis or after going outside help prevent COVID infection?
Absolutely not, and I love this question. This is a good question. Now, what do I see in my COVID ward round is that every patient invariably ends up buying a steam inhaler, steamer device. Now, steam is the water, condensed water particle is never kind of that viscosity or particulate size to end up in the breathing tubes of the lung or the breathing units of the lung called the alveoli. However, the amount of time spent in steaming can lead to inhalational burns in the upper airway. We have had people coming in with no COVID, but lot of respiratory symptoms, all secondary to excessive steam. We have also had two patients who came in trying to sip warm, hot water continuously over a period of 5 days, ending up with a esophageal ulceration, food pipe ulceration. So steaming is only indicated when we are sure that the airway, there is no reactivity in the airway, that the individual is not an asthmatic. Second, they have very thick phlegm or sputum, bulgum. So in those situations, the water vapor will condense and reduce the viscosity, probably contribute to breaking down the thick mucus strands. But in COVID, I don't think there are, though there are number of papers submitted in lower impact scientific journals, none of them have been proven beyond doubt. Therefore, I would say always maintain 25 centimeter distance between the steamer and the jaw. Do not use more than 2 to 3 minutes, and do not use more than once a day unless you have some pre-existing condition or your medical practitioner has really advised you to use it more times. I think we need to stop this and get back to our lives. So no steam is good.
All right, that's very eye-opening. I also, have heard this a couple of times, so that's something new that I'm learning. Thank you for that. Uh, does living close to traffic and away from traffic within city limits make any difference in air pollution intake?
Correct. Definitely, it does impact not only health, it does impact many other aspects of our life. If you look at those buildings that are close to the main roads, the national highways, extremely busy, nightmarish traffic junctions, the amount of external painting done, frequency of painting done will be more compared to those areas which are far off from these busy lanes. Using paint is a big contributor to air pollution, directly and indirectly. Indirectly, because preparation of all these paints does involve polluting the atmosphere a lot. So that is these are some of the fringe things. But if you look at direct living, dwelling next to a highway or a busy way, does have great impact on the health of an individual. These are some of the things that have been proven in an open label study rather than a meta-analysis, which is a benchmark.
All right. The next question is about asthma and sinusitis allergy. Same question, but two different ailments. So I have combined it into one question. There are two different participants who've asked this question. Is there any permanent treatment or medicine for asthma or sinusitis allergy, doctor?
Unfortunately, no, there is no permanent cure for allergic phenomenons, including allergic rhinitis and asthma. When we say sinusitis, there can also be non-allergic sinusitis, which can be cured to a large extent. But by and large, all the upper airway or lower airway allergies is not a curable thing. You can have reduction in the symptoms naturally or with medications, but that doesn't make it a cure. When we sit and talk to our patients, we do take them through a PPT to make them understand that there is a genetic gene guided command to our immune cells which continuously liberate chemicals as if the allergen is always there in the vicinity, and there is going to be what we call as remodeling of the airway. The actual outer coating and the inner coating of the airway keeps changing to protect itself, and when this change becomes totally alien to what it was, that is called remodeling. So let us say I have no symptoms and I stop all my inhalers. Bingo, 10 years, 20 years later, I may not even respond to medications because the airway nature itself has changed. Therefore, the quest for finding a cure has led us to swallow, the famous Hyderabad or the infamous Hyderabad fish, to various other branches of medicine, down to bronchial thermoplasty, to biologic designer molecules that are actually in market and we do use, but none of them can change our genetic constitution, and there is no cure for asthma.
All right. The next question is quite interesting, Doctor. It says, as a chemical engineer, when we work for any organization, it is important to achieve the targets. So, in process of that, sometimes the chemical engineers have been in a dilemma of taking care of environment or to work against the targets. What is your suggestion to make a balance between the two?
It is a very practical question. There are no easy answers. Having said that, I would say I would relate myself to this particular question, even though the question of target is not there. My target is my patient getting better. So let us take the entire pandemic. During this pandemic, in the first few months, even I was scared. I would be dishonest to say no, I was not. I was very much scared. But then every day donning the PPE, having 2 baths a day, 6 to 8 hours in a PPE with no means to drink water or change any of these things. So we had to do it because we had to protect ourselves in the first place. But more importantly, our targets, to meet our target, which was to have least possible mortality and less disabling financial situations to our patient community, we had to do what we had to do, and we are currently also doing, even though the numbers are less. I think this is the cue. Targets are always there, but health becomes prime. You may meet the target, and if you haven't taken enough and more precautions in the nature field of your work, that is no consolence for the target, even though it is may be achieved. So I would say prioritize your health.
Great answer. Thank you so much. The next question is, does taking anti-allergic pills on a long-term basis have any side effects for patients with rhinitis?
Most of my female patients, when I tell them that can we put you on an alternative to long-term antihistamines, they say no. But when you tell them that antihistamines by and large contribute to hair fall, they say, okay, doctor, please give me a prescription for an alternative to antihistamines. Antihistaminics are to be used very judiciously. I am aware of fixed dose combinations that people take on a very, very, very regular basis, and that is not to be done. There are wonderful, exciting treatments and a life beyond antihistaminics for allergic rhinitis patients.
All right. A follow-up question on the steaming part. There's a participant who's asking, is saline nebulization better than steam? So it may not be related to the previous question, but again, related to steam.
Yes, the participant who asked this question needs to be, given a small incentive, because I suspect there is a bit of a medical background or some knowledge there, and I'm very pleased with that, because yes, saline, when we say saline, we will be meaning 0.9% sodium chloride, and that is isotonic with the respiratory tract. What it means is the fluid that I'm nebulizing to get it into my lung has the same ion concentration of what is there in my respiratory tract. So let us say if I use a higher salt concentration, 3% sodium chloride, the salt at greater concentration will sit on the lung cells and dehydrate them. Equally, if I use less than 0.9%, the water content may theoretically make the lung wet and swell up. So 0.9% is what we are referring to. And saline has a very good effect on the lungs, especially in the COVID scenario. Having said that, if you are looking at salt therapies, there are number of what do you call that, spa therapy for asthma, where they will put natural salt, douse the individual with natural salt, or get the person to spend an hour in a cave like situation, which is primarily rock salt and natural salt. That has absolutely no meaning. Saltwater nebulization, saline nebulization, that too sterile at 0.9%, has good humidification effect on the nose, upper airway and lungs as well.
All right. Thanks for the answer. The next question is, as you mentioned, pollution could cause migraine. Can you please suggest how can I overcome migraine?
There are certain well-established truths into managing migraine. Even though the disclaimer being I am not a neurologist, but I'm a doctor, I do look at my patient as one wholesome individual rather than this is a case of migraine, this is asthma. Having said that, in migraine, there are number of studies that point out that migraine control is directly proportional to the degree of sleep that the individual has. If you have good night sleep, your migraine has better chance of being under control with whatever medication you are on or prophylactic preventive medications. Indoor pollution, untreated allergy, or pollution leading to not so controlled, well controlled asthma allergy will impact the sleep, and most of these patients suffer from sleep maintenance insomnia, and next day they have increased frequency of migraine. Therefore, directly or indirectly, allergy, atmospheric pollution, indoor pollution, and Mr. Migraine are all three sharing the same space.
All right, doctor. Could you also help us understand now that we have, especially we have participants joining in from the north. Delhi is filled with smog and fog, right? And the pollution levels, like as you can, visibly see, is really, really bad. For those who are highly impacted, what are the corrective measures or tips that they can take from you to ensure that they're protecting themselves?
Yes, so Delhi is an enigma at the best, but I think it is also there is a geographic disadvantage. It virtually sits at the foothill of Himalayas, even though far. The air currents tend to move from eastern Himalaya down to Delhi, contributing to more smog. And Delhi has a huge vehicular traffic. I think the government tried the alternate day, that day, odd day, even day. All this has been tried, did not help. So the question that you ask me is that what can an individual do? So to reduce on an individual basis, how do you contribute to lesser pollution? So that is one question. And then how do you improve? Improve, the best thing is planting. If there is land availability and you have the luxury of few extra square feet, planting a tree is going to be your lifeguard. Remember, indoor plants do produce oxygen during the day, but they do release a bit of carbon in the night. So indoor plants are not a big relief in this thing. Then everyone as a member of Delhi community should be looking at refuse, reuse, recycle. So initiatives to reduce plastic and other things, carrying bags. So these are some of the things that Delhi can do. I think Delhi more to do is the resolve of the government. How can it, work hand in glove with the industries to help them innovate, uh, incentivize them. And so this is what an individual can do is influence your corporator, influence your government. So basically get a change, and industry does need help, especially in the COVID related economic depression that we are all in. Industry also does need a lot of help from the government. So, and it can be a vis-a-vis. So I think these are some of the things that individuals can do in Delhi.
Great suggestions. Thank you, Doctor. The next question is, how long can one wear a mask? Are there any negative impacts if it is worn for too long?
Yes, I wish I could take my mask and show you the kind of skin scarring and sometimes, frankly, so much of irritation. Uh, During the peak of COVID, we would wear the mask along with the PPE for not less than 6 hours at a stretch. Now, fortunately, that 6 hours coincides with the mask efficiency, and wearing a N95 kind of a mask out in open sun, the particles do melt. So your mask looks the same, but it doesn't filter particles that should be filtered. So on this mask business, we tend to see that people tend to pull the mask down when they talk. Remember, the mask is of paramount importance when you are trying to talk or listening to someone. Please have the mask on. Point number one. Mask is not for the jaw, nor is it a carafe or a tie. Therefore, leave it to cover the nose and mouth. And till we get rid of this COVID, entirely mouth and nose are going to be private parts by and large. So mask, if you use it for less than 6 hours. If it is a reusable mask, put it for wash, but put on a new one. So
All right.
this is the thing about masks.
Makes total sense. The last question for today, Doctor, what do you think are the tips one can take for natural management of allergy? It may not necessarily require medication, but you have like mild symptoms of allergy. And are there any specific exercises one can do for controlling, managing allergies?
There is a term called exercise induced bronchodilation, which means when I exercise, my airways tend to dilate a little bit. And in asthma or allergy, there is spasm of the airways. So exercise can theoretically help some individuals. But then what I would say is that I would say please fundamentally oppose this idea of treating things in the most natural way. I don't want medication. I don't have symptoms is not an indication not to have medication. I wish natural things would have helped. And there was a New England Journal of Medicine paper way back which spoke about when did man develop allergy, human beings. Was it in the Paleolithic age, Neolithic age, what age? So I think our ancestors were all without apartments and mansions and villas and villaments. That time they were one with nature, and possibly the amount of allergy was less. Now once you have an indoor kind of setting, all the natural things that you think stops immediately, because when you say a house, you have lots and lots of allergens. So natural things what you can do is not a substitute to medicine, but put all the wheat, jowar, ragi, rice, all these things, instead of a gunny bag, put it in a steel container and the lid very closed. Fridge to be cleaned, and do not let the fridge to or regularly defrost. Division of labor at home. If you have asthma or allergy, do not clean the bedspread or change the bedding mattress and other things yourself. Do something else in return for some other family member, cleaning the bedspreads. And when the mattress is being cleaned, stay out of the house. So these are some of the natural things I think you could do. And pranayama is known to help. So is 45-minute walk done in a gradual manner, but do not take this as a supplement to medication.
All right, absolutely useful, insights and topic. Thank you so much, Doctor. We are really grateful that we conducted this session today. I am sure it's an eye opener, and many of us are going to get back to our work and our normal lives with a lot of learning.